Okay, so we couldn't figure out how to get the Facebook Facebook Live. I don't know why. It's got to be a glitch on my end because other people are doing it, but I couldn't seem to get her on. So we are FaceTiming each other, and I'm actually holding up my phone and videotaping. So we're going to do it this way. But this is Tara, and I met Tara in Washington, D.C. when we were there for the FDA hearings. And she coughs a lot because she's quite ill, so just bear with her. But that's why I wanted to get her on here. Because she was supposed to be one of my roommates in Washington, and I ended up swapping her out for Annette. Annette is the one, I think I told you, Tara, who saved my life and told me about the breast implant illness, and I didn't know about it. So I asked Tara if she would be so gracious to swap rooms with Annette, and so she did. And so I stopped in a restaurant we were all in and got her story when she was sitting in a booth and encroached on all her dinner time. But it's getting worse for her because yesterday and today it's just an ongoing saga for Tara. And so I just thought, you know what? All these doctors tell us that, oh, no, you're not sick. And I'm one of the lucky ones that I thought I was dying until I talked to Tara. And then I realized I am really one of the lucky ones. So this is Tara, and I wanted Tara to tell you her story and what the heck is going on. Because what's the latest? And, well, why don't you just tell everyone how this all started for you and then give them the whole shabam.
It's a lot.
That's all right.
So I'll try to be quick about
it. I don't know how you're surviving this, honestly. When I hear you talking about it, and you're on Medicaid, which she's on Medicaid now. And I think when you're on Medicaid, I don't think you get treated very nicely because I have friends who are on Medicaid and they tell me that the doctors treat them like they're dirt bags. And it's just not the case. And I just think it's very unfair how the government runs Medicaid and how they treat people. So there you go. Go ahead, Tara. I know. And I'm sorry you're coughing.
And it'll probably get more, I'll probably be more worse whenever I start talking after a bit. But so 6 years ago, this whole thing started. So I really am coming up on what I call my 6-year boobiversary. On July 18th, 2013, I had a prophylactic double mastectomy with immediate breast implant reconstruction. And so the reason why I had the prophylactic double mastectomy is because my dad died of breast cancer and my sister was diagnosed with breast cancer before she turned 35. I have a maternal aunt who had breast cancer. My paternal grandma had breast and skin cancer. So I'm technically the only one in my immediate family that does not currently have a cancer diagnosis. And I wanted to keep it that way. My mom had thyroid cancer and a rare neurological disease called polymyositis. Her version of polymyositis has the anti-SRP antibody, which makes it even more rare for someone to have. But she lucked out and somehow didn't get the breast cancer part. So I didn't want to end up like the others in my family.
Right.
They did the genetic testing for me in, I think it was technically 2010 or 2011 when they did the genetic testing. And at first it came back undetermined, like unknown variant. And then they recategorized it. According to the doctor that I saw yesterday, they recategorized it in 2012, according to him. But according to my second opinion at Mayo, it wasn't technically considered BRCA1 until 2015. So I don't know who to believe on that one. So anyway, after I had my double mastectomy with immediate reconstruction on July 18th, 2013, I had complications from the start. So I had post-op seromas with the first set of implants, and it was hard for me to get the nurse then to listen to me. And the only thing that was able to get me back in like 2 weeks post-op was, I'm like, there's something sharp poking up, because she said a little bit of fluid was totally normal. But the something sharp wasn't, which was a stitch And so when I went back in, they ended up draining like 100 cc's from each side.
Oh my gosh, that's a lot.
And I had to go back about every 2 days because the seromas would not go away. So it took about a month before the left side finally cleared up. The right side, I didn't know skin could fail, so my skin started to fail. And then the alloderm, it became exposed. I did not know that alloderm was derived from human cadavers until my second surgery, and then I started doing research on it and how it's like more common to have post-op infections.
What is alloderm?
So alloderm is a surgical mesh that we learned last week.
Oh no!
Has not ever been approved by the FDA.
Oh, did they slide it through on the 510K? Did they slide it through on the 510K?
They didn't even tell me that it wasn't FDA approved.
Well, not like that matters anyway.
Right. Yeah, that's true. It doesn't matter because the breast implants are technically approved.
They're safe.
Yeah, totally safe. That I went through 2 sets of smooth implants, and I'm on my 3rd set of implants, which are the textured 410 Nitrels. I ended up having to have a second surgery September 5th of 2013. And that is because the skin failed, the alloderm became exposed, so my surgeon took out the implant, washed it off, washed out the pocket, and put the same implant back in.
I remember you telling me this in the restaurant, and we all gasped. We're like, I don't think that's allowed. You're not allowed to do that. And I don't think, I'm almost positive he could get in big trouble for that. But who's going to tell him? Who's going to stop him?
Right. I mean, I've been trying to get people like held accountable and getting them to do their job for a while now. And all it's gotten me is flagged as a disruptive patient.
Yep. Like that Seinfeld episode. Did you see that when they flagged Elaine?
I'm Elaine.
Yep, it happens.
Well, sadly, but I mean, that's what you get for trying to be, well, I mean, actually, it wasn't a mean patient. I actually took them cupcakes, and they thought that was disruptive at one point, too, because whenever a nurse is not like you after she finds out that you're married to a female, it just... some people get mad at stupid stuff.
Yeah.
But, anyway, the delayed attention to the initial seromas seemed to be what kind of led to the post-op infection the first time. I ended up getting MRSA.
Gosh.
And so I had keratosis pilaris before, which is like, it's like a little bumpy thing. It's like on your arms, like kind of like ingrown hairs. And that is what everyone thought was like all over my chest as well. After I started having nonstop itching after my second surgery. And then I started getting like these ulcerations on my chest, which, is also a symptom of ALCL that's related to breast implants, but no one believes that that can be related to smooth implants. Anyway, so I keep getting this rash and these ulcerations, and so my surgeon he would excise them and send them to the lab, but never tested for malignancy. It just came back as giant cell reaction, which, that's foreign body reaction. And so the end of January 2014 rolls around, and I have a giant abscess form on my right hip. And then I have to have that surgically lanced. And that was MRSA also.
Oh my God.
Then, let's see. I had to have my wound packed that was on my hip for about 6 months. And in the meantime, I started to get deep, rippling and stuff around my implants that I hadn't even had for a year. And I'd had constant shifting and pinching pain on my right side because after my surgeon put the same implant back in that had been infected, it was lower and there was a dent that it created, and then it would constantly shift into my armpit, and it was incredibly painful. And so I had to like beg him to try to do something to fix it. And when my hip wound finally healed, he agreed to do reconstruction revision, and that was June of 2014.
And at that point, you still didn't know that the implants were toxic?
No, I didn't. But I had managed to lose miraculously. I've been like chubby my whole life, and after getting the first set of implants, I dropped weight like that, and I'm like, I don't know what is happening, but okay.
Wow.
I didn't change my diet. I didn't really change my exercise level, and so I mean, I started at like 237, and by I think it was January of 2014, I was at 180, and
Wow.
there was no explanation for it, but my hair started falling out. And every time that I asked my surgeon and the nurses, I'm like, why is my hair falling out? They just kept saying it was because of the anesthesia, because of all the surgeries that I'd had. And I'm like, okay. I didn't realize anesthesia caused your hair to fall out. So anyway, he finally agreed to do reconstruction revision. I continued to have like the rashes on my chest. I had had increased sweating, and it was really bad. I was applying deodorant like 8 times a day, kind of thing. And with all of the weight that I had lost, I had redundant skin on my arms. So like the edge of my incision for my surgical site was constantly wet, and it really wouldn't close right. So I had to borrow money from my mom, and she paid for me to have a bilateral brachioplasty to remove the excess skin, or both of my upper arms. And while I was under for that surgery, the hospital here was in the process of attaching the ventilation system to their new children's hospital.
Oh, no.
And something happened and reversed the airflow. So while I was open on the table, it pumped contaminated dirt and debris into my OR. They didn't really share that with me. I babysat for OR nurses. One of them is now deceased. He passed from skin cancer. He was a great person. That whole family is amazing. But he would kind of keep an eye on me. And he and his family, like, they're the ones that told me, like, everything that happened. Because there were 10 ORs that were contaminated. And I thought it was weird and uncharacteristic when a nurse from plastics kept calling and checking on me to see how I was doing, because no nurse previously from plastics had ever done that. And I didn't remember any of them having that name. So I'm like, something seems sketchy. Why do you care so much? Because
Yeah.
when I'm at my appointments, nobody seems to care this much. So.
Poor baby.
Anyway, so that's, I mean, I found out a little bit more about that, but nothing was really, there was no paperwork that I was like given, no information as to like what kind of debris it was, like if it was big amounts, if it actually got into my chest or not. And my doctor really didn't ever want to talk about it.
Oh, of course not.
Like, forced him to talk about. I mean, like, it's not that it was necessarily his fault, because he doesn't control the air system, but I mean, the hospital should have said something to me.
Right.
But anyway, so we continue down that road, and I'm okay for a little while, and I keep losing weight, and my anxiety is like really bad at this point, which was completely under control. I didn't have like the depression issues. Like, I was at a good place before I started all of this. I was married. I was like working full time, and I'd actually just gotten into the College of Education here to go back and get my teaching degree. So I was working full time, going to school part time, and coaching whenever this all started. And when 2014 rolled around, like, I couldn't do all of that anymore. So then I was just doing working and coaching. And then I started to have like the rippling again, and like whatever he had done to try to anchor it in place on the right side to keep it from shifting wasn't working, and it broke loose and was back in my armpit again.
Oh wait, the textured ones that aren't they're supposed to stay in place?
Yeah, so the textured ones I got in 2015.
Oh, because that's
so
loose too, right?
Yep, it still shifts a lot, and it is not the right shape. So it's supposed to be teardrop shape with the top up here. The top is not up here. The top is over here in my armpit. Or it's ruptured. But after I've had MRIs at this point, nobody thinks that anything is ruptured. And I constantly get told the myth that ideal implant guy told us, which is that like gummy bears don't rupture. It's like, yes, they definitely
what a bunch of crap that is.
Right, because like, was it Roxanne or Carol? Like both of them had to have that scraped off their ribs, what they were saying. One of them lost ribs, I know for sure. So I'm like really paranoid that that's going to happen to me. Since that whole second surgery thing failed, then I had gone for a second opinion with my surgeon's colleague, because he's my surgeon, my original one that has since basically abandoned my care, had told me I could get a second opinion from his colleague about deep flap, which is deep inferior epigastric perforator flap, which where you use your own tissue in your like lower abdominal area. And at that point, he said I was too skinny, but I could try a new implant that the FDA had just approved, called the 410 gummy bears, because the texturization is what would hold it in place. And he said that should mitigate the issue and keep my implant from shifting into my armpit. Because he said what I had with my surgeon, like what he and I had, was a good thing going. He didn't want to mess with it. So he told me to ask him. And so I asked my surgeon, and it took like convincing on both of our parts to see if it would be worth it. And I ultimately decided I didn't want to be in pain anymore, so we would give it a try. And then
so you have to pay for every one of these surgeries? I
did not.
Oh.
So at the time, I used to have my insurance through my employer. I worked for a local school district.
Okay, good.
And then I had insurance at the same time. Like I was double insured through my employer and my spouse's employer.
Okay, good.
So insurance paid for it because it was related to the mastectomy and my genetic risk for it. And I was, when did my divorce finalized? In February 2015. And so I could only be on her insurance for so much longer after that. And so then I ended up losing one of my jobs. So I had nothing, and that resulted in Medicaid. And so I had Cobra at one point with Medicaid, and then the Cobra ran out, and then it was just Medicaid. As soon as it became just Medicaid in 2016, in the fall of 2016, that's when my care was basically dropped in no longer consistent in plastics. I didn't have proper follow-up for the nipple reconstruction, and now, like, after he did the nipple reconstruction in March of 2016, only one of them has survived. And
awful.
I was never given the opportunity to have the nipple tattooing, not even like around like the ones that he rebuilt, or the 3D nipple tattooing over the area where the one failed. So my reconstruction has never been completed. And at one point, when that nurse was being a total wench to me after finding out that I was married to a female, like, she had threatened, like, she was like, you know, this is serious shit, kid. Like, you should have come in sooner to have, like, these seromas checked out, all this stuff or whatever. And I'm like, I tried. And she was like, you could lose your implants and have to start all over. And it's like, I swear to God, she jinxed me, because, like, I've started over 3 times now. And after yesterday, I'm going to have to basically be flat because the surgeon that I saw yesterday, which I replaced with someone else, reinserted himself into my care, and I have no idea how the heck this is even happening.
Because it's Medicaid and you don't have any control over it, right?
No, so
you're powerless with Medicaid.
My Medicaid person, because they privatized it here in Iowa. So I have a Medicaid rep with me from United Healthcare who's been helping me the last 2 years. She helped me get a second opinion at Mayo, but the referral to Mayo was tainted because the physician here, not my PCP, but the specialist here, told them it was all in my head, the issues with my implants. And so I got nowhere at Mayo. Mayo pretended to do the CD30 testing on the aspiration that they did at the end of June, but all they did was rerun the aspiration results from the University of Iowa on June 4th what was last year? 2018. God. So they only aspirated one side in 2018, and the fluid didn't get properly attached to the order, so it was just sitting in the lab for 2 days, and nobody knew what to do with it. So whenever I called the lab, because I didn't see the order populate like it was supposed to, that's when they made the connection. So I have no idea if it was stored properly in the interim or not. So I don't know if those results are accurate. And
the incompetence.
Well, I mean, if you have breast implant associated anaplastic large cell lymphoma, it can be negative in the fluid but positive in the capsule.
Yeah, so they need all of it. And
when I first started showing symptoms of the ALCL, it was in the fall of 2017, and I went to the head of surgical oncology because he had done my mastectomy. And when I told him my concerns, he was like, "There's no way you have this disease. It's extremely rare. You have more of a chance of getting struck by lightning than having this disease."
What are the symptoms? Tell everyone the symptoms.
So the symptoms that I have 4 out of 5 symptoms, and that's rash, widespread lymphadenopathy.
What's
seroma,
that? What's lymph? What's lymph?
Lymphadenopathy. So I have enlarged lymph nodes.
Okay.
All throughout my chest and up into my supraclavicular area.
So a symptom is enlarged lymph nodes?
Yep, enlarged lymph nodes in my, they're around my heart and my lungs.
Okay.
And they were up into my supraclavicular area, in this area, and they're in my periaortic and my hilar, and I think they were also lit up on my PET scan around my liver, my hepatic aorta, which was really weird. So, and the inframammary area in my axilla.
So you've got rash, you've got enlarged lymph nodes. What are the other?
Mass / lump or whatever, and then capsular contracture. That's one I don't have. I do not have capsular contracture. But night sweats and fevers, I have those.
Is it a constant?
Not because I'm menopausal, because I'm only 35.
Yeah, but they'll label you as such. Is it constant fever, or does it come and go?
No, it comes and goes.
And the night sweats come and go, or are they constant?
They come and go also. And my the fatigue is ridiculous.
Yeah.
I have ADHD, so I take stimulant medication, and even with my ADHD meds, I need a nap in the middle of the day. And I went, like I said, from working full-time and coaching and going to school part-time. I used to also walk 5 miles a day for fitness, and I can barely walk 3 city blocks without needing a nap, to rest. And I mean, it really has impacted my dog, which I had to get my dog to deal with my anxiety because it got to the point where I really couldn't handle going places by myself. And so it's been a horrible 6 years.
And the coughing, what do you think the coughing is?
So last year in June is when I started to get really short of breath and much more tired easily. And I had increased tightness in my chest, even though I had excuse me, some of the fluid drained from my right side, or my right breast.
Poor baby.
So, I thought it was really weird, but then I started to get really horrible chest pains, and sometimes it feels like something is like literally squeezing my heart, like to the point that it can't even expand.
Yeah.
And then the pains will shoot off into my arms and down my spine. But I went to the ER and they did a blood test, and I had elevated D-dimer, which is like a clotting factor, and it's usually indicative of like a blood clot in your lungs. So then they did a CT scan to discover, like, to see if I had a clot, which I did not. But to their surprise, when I ended up in the ER the very next day, secondary finding was all of these enlarged lymph nodes in my chest, plus fluid increased around my right side again and on my left. But it will always stand out in my mind because it was the mom of one of my volleyball players that was the physician, and she came in and was like, there was a secondary finding on your CT scan, and so we think that it might be breast implant associated anaplastic large cell lymphoma. And I was like, I've literally been trying to tell people this, that I have the potential for it, for a year. And to have that news delivered as a potential to you is like more upsetting, I think, as a potential validation.
Yeah, because you've been ignored.
Exactly. And so I was like, okay, so now what do we do? And she's like, well, you need to follow up in plastics. And the last time I had been seen in plastics was June 14th of 2018. And after that, I had gone for my second opinion at Mayo, and Mayo basically just sent me right back here because they don't get reimbursed at the same rate with out-of-state Medicaid. I only had enough for a second opinion. They also dismissed what I told them, and they said that I could have the same level of care at the U of I, so there was really no sense of having it done at Mayo. And that due to my complex history of complications post-op, that it was actually not as safe to have it away from home. And since I live really close to the U of I, it was just easier to have it at home and to go back to them and go from there. But since then, I've not been seen by plastics. They just won't schedule me. And I don't know if that is because they're afraid of liability because of all of this stuff that's coming out about the textured implants. And I mean, I really just want them to do their job. That's all I want them to do. Like, take out the implants, and after I'm healed, help me get, the autologous reconstruction so I'm not flat for the rest of my life. But that's not what's happening. They're not listening. They think I want more implants, and I'm like, I'm not insane. That's not what I want. And I've written countless letters to my plastics person because the one that I had was the chief of plastics. So you would expect, top-notch care, which I had at one point. Had. So to go through, I'm technically on my fourth set of boobs because I grew my original pair and they're gone. And then to go be on my third set of implants, obviously that's not working out for me, but I also don't want to die from this. I've seen rheumatology, I've seen pulmonology, dermatology, which I have to go 3 times a week for skin treatments because the rash is no longer just on my chest. It affects my face and my arms and my back, sometimes my legs, but not as often. And my hands are really gross. Like, they look all scaly, and they change color, and they bleed. I didn't have eczema before I had these implants. I have the increased risk according to the research articles because I've had Epstein-Barr since getting these implants. And with the recent FDA information about the previous sets of implants adding to your risk, and the fact that this has all been breast reconstruction because of my genetic risk, and the eczema is indicative of autoimmune reaction, I obviously am at heightened risk that way. But the surgeon that reinserted himself into my hair yesterday, who told me he has done literally 0 of these surgeries a year, has me terrified that one, I'm going to end up dead because he doesn't know what he's doing but thinks he does, or that I will wake up completely mangled beyond the point of like repair, so then I will never be able to have reconstruction. And that's really terrifying to me because, like, not that looking like a dude is a bad thing, but like when you get used to the way that your body looks and you've been big chested most of your life, to be faced with losing that and then like potentially losing your life because there's a surgeon who's like irritated and bitter toward you because you wouldn't shut up about the potential for breast implant associated lymphoma, and he's taken over your care again, and still doesn't believe that you have this disease and that's not possible, but uses that as a reason to reinsert himself into your care and not let you see plastics because he's an oncologist, and if there's any potential lymphoma, he would deal with it, even though he really doesn't believe that I have it. And so anyway, I'm faced with that, and I don't know what to do. I wasn't expecting him to come back with the response of, I do this surgery 0 times a year. And when I asked him if he could remove my implants via N-block, where you remove the capsule along with the implant, so if there's fluid between the capsule and the implant, it doesn't spill into the surgical site.
Yep, it's very important.
Right. I tried to explain to him the reason why it was important because there's no definitive data on whether or not if there's fluid in there that's positive and gets spilled into your surgical site, whether or not it can spread from that. He told me it didn't matter how it was removed as long as the implants were out. And I was like, the implants are not the only thing that has to come out. The capsules absolutely have to come out because that, without doing that, my risk is not removed fully. And it would be even harder for me to get anybody to believe me if he documented that he removed them, but since he doesn't do it normally, 0 a year.
That's not comforting.
What?
That's not comforting to have somebody operate on you like that.
No. Especially when he tells me that he'll do the capsules and the implants, and then he sends the resident back in with what I call the uninformed consent forms. And the form only says for bilateral implant removal. And I was like, that you need to go back out there. You need to write down.
Good for you.
That, it says bilateral implant removal and capsule removal, plus CD30 testing to rule out breast implant associated anaplastic large cell lymphoma, because I've been a member of these groups on Facebook for a while, and I have seen too many women not get better because their surgeon lied to them and told them that they removed the capsules, and they never did. And I asked him also if he was a microsurgeon, and he said, no, that didn't matter. And I'm like, it does matter.
See, this is what I'm saying. It's no wonder they say only 10% of us are sick, because they don't first know what they're doing. Second, they're not reporting that we're sick. I mean, these guys, they don't know what they're doing. They have no clue. It's sad that we know more than them.
Right. I literally took him because my therapist and my PCP believe me, and they've believed me for the last 2 years, and they've been advocating for me. So my therapist printed off all of those pages for that Dr. Mark Clemens showed us at the FDA which is basically a pictorial on how to do this and care for the patients. And it would be easy for any surgeon to look through and be like, oh, that's what I need to do to help this person. He would not look at it. And he actually like put it like further back on the desk and then walked out of the room without it.
Wow.
So, and that's the chief of surgical oncology.
So now you're stuck because you're Medicaid, right? You can't switch to another doctor?
I have no idea. I've been referred by dermatology, by rheumatology, pulmonary people, the ER 3 times, MIPCP, even other surgical oncologists. I've been referred back to plastics at least 6 times within the last year. And this guy is claiming that I don't need to be seen in plastics. Obviously I do. So my insurance is trying to figure out how to get me into plastics. It seems like that would be easy to do given all of the documentation and the need for it. But we don't know, because apparently you can't force someone to see you in this state. I don't know that they insurance through my employer. I don't know. But I mean, if you're a breast cancer patient and you're on Medicaid and Medicare, there's no problem for you to be seen, because my sister was seen in plastics a couple weeks ago. And the surgeon that had told me to ask my surgeon about the textured implants told my sister that he doesn't recommend textured implants anymore because they're dangerous. And they
finally.
Lymphoma. And I'm like, well, at least they're getting my emails, because I'm sending them all emails.
My gosh, finally though.
What?
Finally, they're starting to acknowledge.
Yeah, and so my sister had asked him. I'm sorry. My sister had asked him, so what happens if you have a patient that tells you they're symptomatic of this disease? And he said to her that he would immediately remove them. And my sister was like, that's funny, because I know someone who's been trying to get in to see you guys for a really long time now, and she's been symptomatic and no one will see her. And so it was kind of one of those moments where they're like, we haven't heard of anybody having issues really in this state, except for one person that was diagnosed with the actual
They're so full of it.
disease in Des Moines. Yeah. But the rheumatology people that I've seen that told me that I should go back to plastics, and infectious disease was the other one that I saw. All of them have sent me back there. When I saw pulmonary last Thursday, after getting back from the FDA, he said he'd been following the FDA hearings, and he went back through my record, and to finally have a fellow tell me, I went back through your stuff, I looked at your scans again, and I believe you now that this really is all related. It's most likely all related to your implants. He's like, we can't for sure rule out the fact that this is implant-associated lymphoma, just like we can't for sure rule out that this is silicone-induced sarcoidosis.
So we're just going to wait till you are like on your deathbed or dead, and then we'll confirm it.
Well, I mean, silicone-induced sarcoidosis and sarcoidosis in general is what they call a diagnosis of exclusion. So once they rule out everything else, then they're like, okay, it's sarcoidosis. But I mean, the ALCLs you would think would be a little bit easier to diagnose, but not if out of the 200 cc's the U of I drained from my right side, they only tested 60 cc's. And when they tried to do a bronchoscopy, because my PCP fought for a PET scan, and the PET scan is what showed all the lymph nodes lit up after the CT scan. And so they tried to do a bronchoscopy. When they left the procedure room, they allegedly had enough tissue, but somehow didn't have enough tissue once they got to the lab. So it was inconclusive with that way. And then they did a lymph node biopsy, an excisional one, where they cut my neck here, and supposedly they took 3 nodes, only 2 made it to the lab, and only half of one was tested, but it came back as like reactive and granulomatous response, which would be more indicative of like the like sarcoidosis kind of response, but still we're unable to rule out the ALCL. But when Dr. Clemens showed us all those slides of the PET scans that came back positive, I noticed that on one of them, most of them that had the tumors, in the mediastinum area, like right by the breastbone kind of thing, I have one lit up, and almost all of them that he showed us had the same spots lit up on the PET scan.
Ooh.
And so I asked the pulmonary person on Thursday if how to go about getting to that. Like if plastics ever sees me and removes my implants and everything, like would they be able to access that? And he said that if I was already having surgery, that it would be up to them if they wanted to try, but it would be a hard point to access. But he was going to reach out to plastics again. I have no idea if that actually happened, because in the meantime, I saw the surgeon yesterday that does 0 procedures of 0 explants a year. And I asked him if, when he was doing the explant, if he could do, access the lymph node area and biopsy that. And he said, no, because it's not close enough. And I'm like, it's right there. I know it might be behind a rib or something, but it's right there. And if you're already removing all of the lumpage between, yourself and my breastbone, why would you not take advantage of that and biopsy it? And he just doesn't believe that I have this, and it's not something that you can just look at and be like, oh, she's fine. So I've learned a lot about misogyny in medicine and how I don't matter once I'm over 30 and I'm single. And I mean, it's like I'm invisible. And once I'm on Medicaid, it's like, oh, you clearly are lazy.
Yeah.
And it's like, no, I'm tired and I'm sick and I'm tired of
and getting sicker.
Tired.
You're just getting sicker.
So then whenever we were at the hearings last week and that one woman was at McGrath, was like, okay, but if we take textured implants off the market, what are breast reconstruction patients going to do? And
they're going to live. That's what they're going to do.
We're not going to freaking worry about lymphoma.
They're not going to die.
Oh my God. If my choice is if at the beginning of all of this, if they had told me that if I got implants that I would need tons of surgeries after, and that they weren't lifetime devices, or I could have, tram flap or deep flap, use my own fat or whatever. And yeah, I would be down and out for a month, but it was only going to be that month.
Yeah.
I never would have chosen implants because
Right.
This was supposed to be a one and done. And here I am 6 years later, and I can't do half the crap that I did before. And I don't know how I'm ever going to date again. So, especially if he removes my implants and then leaves me flat. So, how do you date flat?
You'll find someone that truly loves you for you. You
have
will.
To be able to stay awake.
Well, I mean, if that matters to somebody, then you shouldn't be with them anyway.
I try to tell myself that.
That's
but
true.
At the same time,
and you're a beautiful woman. If somebody, I'm serious. If somebody cares about that, then I don't want to see you with them anyway. So move along, and you'll find someone. You'll find someone.
They would have to like Walter too, though. So I mean, he would have to approve.
Walter's, he's a bulldog, English bulldog?
He's a French bulldog.
French bulldog? Is there such a thing as an English bulldog? I don't know.
Yeah, there is an English bulldog.
He's a French bulldog.
There he is.
Hi, Walter.
Walters, come here, Bobby. You gonna come here? Come here. Come here, punk. No, you're gonna be a little shit. Come here. Come here. There you go. There's my baby. Oh, that's a good baby. Yeah.
Well, we're gonna post this story for everyone to hear, because the more stories we keep posting, the more educated the world's gonna become, and these doctors are gonna have to start admitting that they've either been lying or in denial all these years. I don't know how they have such a 8-year education or sometimes longer, and they're still like, gee, there's no medical proof. You know what? We're your proof. We are, and you're ignoring us. So
I mean, I'm relieved to know that, like, at least one of the plastic surgeons in the department here
is admitting that textured.
Yeah, and I mean, at least he admitted it to my sister. It's not the same one that, like, did all of my surgeries, but I mean, it's a start.
Yeah, it's a start.
So, but what I mean, I wish that I knew somebody that wanted to chronicle, like, this entire thing, because I have photos and videos and recordings of the majority of my appointments over this span of time, and it could be made into, like, a documentary. I just don't know how to do it because I'm too close to it. So it's really frustrating.
Well, maybe we'll try to figure it out. How to do that.
Yeah, we could, like, bust open the industry.
All right, well, you hang in there.
Thank you for helping to, like, bring awareness to this and to listening.
Aww.
Sorry if I'm not very, like, cognizant.
I know.
Ready for bed already. It's, like, not even 7.
I know. I was there a year ago. I feel for you. And you were in way worse shape than I was.
I would like to have my life back.
I know. Well, I'll keep praying for you.
Thank you.
All right. You take care. And
thank you so much.
Keep us all posted.
I will. Thank you so much for listening.
And Tara will be, like, under this video. She'll be able to answer questions if anybody has any, right? Once it's posted.
Yeah.
Yeah.
Absolutely.
All right.
Thank you so much.
All right. Goodbye, my dear.
Bye.
Love you. Bye.